Dr. Jim Davis, and I've been in private practice in Atlanta, Georgia for 23 years. I would encourage you to please use our website as an informational tool to educate yourself on any procedure that you may be interested in. Our menu of services have many videos of the popular procedures to help you make an informed decision. There are many surgeons that do cosmetic surgical procedures, and I would strongly encourage each patient to research their doctor and make sure that the surgeon that you choose is a properly trained and qualified surgeon. The only board that certifies plastic surgeons is the American Board of Plastic Surgery. I would look for that. I would look for membership in the American Society of Plastic Surgeons. That is noted with a symbol on all the letterhead and business cards that we use for the appropriate members of the association. I would talk to other doctors and nurses that work in the medical field to find out about the doctor. I would also ask if your surgeon can take you to the main hospital in the community. Many doctors do procedures in their office for convenience, but there are so many surgeons and non-surgeons offering cosmetic procedures in the office because they cannot get privileges. That certainly is a red flag and an indication that you need to do more research on that particular doctor. Every surgeon that is planning to have a cosmetic surgical procedure needs to be fully informed of the possible risk and complications. The patient should also fully understand the preoperative care required and the recovery time that's needed. There are risks and complications to any procedure that we do, and the surgeon should take an appropriate amount of time to fully explain each of these to each individual patient and fully inform you. Doing surgery in an office surgical suite is a very appropriate way to do procedures, and many qualified board-certified plastic surgeons offer that to patients. However, there are many physicians in the community that only do things in their office because they cannot get privileges at the main hospital. Again, it's an indication that you may need to do research on that doctor to find out why the surgical procedure is only offered in his particular office. Again, it's nothing wrong with doing it in an office, but it may be an indicator that you need to find out more about that doctor. Overseas plastic surgery is a popular topic today, and I get asked that quite frequently. The problem with overseas plastic surgery is you may travel to a foreign country where you really don't know anybody, and unless you are a family member and you know the local medical community, you may not really know who the doctor is. And if there's any problem, complication, or need to see the doctor again, you may run into difficulties. And it's not uncommon for us to see a patient that's had a procedure done out of the country and they then have a complication and they cannot afford to go back to the foreign doctor to have it repaired, and it's quite difficult, and they end up having more surgery done here in Atlanta to get problems fixed. So unless you're a local community member of another country, I would recommend that you have the surgery done here at your home and not venture into an overseas plastic surgery trip.